Good evening. My name is Dr. Reed Tuckson, and I'm privileged to be one of the co-founders of the Black Coalition Against COVID. And I am really excited to welcome each and every one of you to this evening's virtual town hall on COVID-19, what's happening in Detroit, and what to expect in the coming months. This timely town hall is hosted by NFL alumni and the NFL Alumni Detroit chapter, along with the wonderful people at the City of Detroit Health Department. Terrific people all. The goal of our event tonight is to help you get your questions answered about COVID-19. We'll touch on where we are today in Detroit when it comes to COVID-19 and what we see coming down the pike. We expect to cover the issues that are on your minds, things such as whether you should still get vaccinated at this stage in the pandemic, the therapies that are currently available if you are unfortunate enough to become infected with the COVID virus. We may talk about the Omicron subvariants that are sweeping across much of the world and now the US as well. And of course, we're going to talk about advice about continuing or not to continue to wear masks and other questions that may be on your mind as well, which we hope that you will submit to the chat function as well. So please take the time to submit your questions in the chat, and we'll get to as many of those as we can during the show. This event is part of NFL Alumni's partnership with the Centers for Disease Control to help educate Americans about the COVID-19 vaccine and encourage them to talk to their doctors. Each and every one of you, talk to your physicians about the issues on your mind, to get the facts and make an informed decision about vaccination and other things necessary to prevent the COVID pandemic from affecting you. NFL Alumni is an independent nonprofit organization whose members represent former NFL players and other NFL alumni, more than 100 former and current NFL players, including 27 Super Bowl champions, 40 Pro Bowlers, and 16 members of the Pro Football Hall of Fame are involved in this campaign, recording and sharing PSAs, participating in local vaccination and virtual events, engaging in social media, and or serving as media spokespersons. Since August of 2021, NFL Alumni has hosted more than 25 events in cities across the country as part of the campaign, including this one tonight here in Detroit. The campaign aligns with NFL Alumni's triple mission around caring for their own, caring for kids, and caring for the community. Well, we have a great lineup tonight, and it's my pleasure to introduce our panelists, beginning with someone who needs no introduction to the city of Detroit, Lomas Brown, former offensive tackle, Detroit Lions, Super Bowl champion, 7-time Pro Bowler, and you hear him on the radio regularly calling the games for the Lions. Denise Fiorazo, Chief Public Health Officer, City of Detroit Health Department, who leads a team of 250 healthcare professionals, all dedicated to enhancing the health of the people of Detroit. Dr. Robert Dunn, Acting Medical Director, City of Detroit Health Department, and who also serves as a professor of emergency medicine at the Wayne State University. He is also a key leader in the vaccination program in Detroit. And then finally, we're joined by Tina Chopra. Dr. Chopra is a professor of medicine in the Division of Infectious Diseases at Wayne State University, and she's corporate medical director of hospital epidemiology, infection prevention, and antibiotic stewardship at the Detroit Medical Center. Well, thanks you all for being here, panelists. And as we begin our discussion, Lomas, we want to start with you. And while I am a very serious and focused person on the COVID pandemic, I'm also well aware that there's a draft coming up in football. And I just have to ask you, what positions do you think are going to be most important for Detroit to fill in the coming days?
Yeah, well, I think the most important position for them to fill probably is to get a rush defensive end. And there's a great guy named Aiden Hutchinson in Michigan. He wouldn't have to move far. All he has to do is move from Ann Arbor on down to the Detroit city. So that's not a far commute for him. Great player. But I do think that Jacksonville is going to take him with the first pick. So I'm thinking, why not go get Malik Willis, the quarterback from Liberty? I mean, again, Jared Goff has another year or two on his contract. Why not get a young guy in there? He's dynamic. He's a guy that can use his legs as well as his arm. So he's a guy that can get out of trouble. And they need a quarterback. They need to start thinking about a succession to Jared Goff. And of course, we seen what Matthew Stafford went off and did this year, going off and winning a Super Bowl. So it's a lot of positions that Detroit needs to fill. But if we could get a quarterback, even though they say it's a reach with that second pick, I would get them.
Well, you know, Lomas, I must say you have surprised me because we've been doing this show with your colleagues all around the country. Every single person that we've asked that question of, what they always say is whatever position they played. And so the fact that you're talking about the defense instead of the offense and quarterbacks instead of the line, I give you credit. You are a true equanimous member of the Detroit Lions family. So good for you, brother. Well, listen, on a serious note, there are a lot of people who obviously are struggling about sort of what their role will be in society, what their role will be as when they finish their careers, whatever your field is. But you have been an active member of the Detroit NFL Alumni chapter, and I'd be very curious about why you've devoted so much of your time and energy to this work.
Well, to be honest with you, it's almost like carrying over from being in the NFL, at least for me. You know, I did a lot of charitable work when I was playing in the NFL, and it's just been natural for me to just continue to do that. And there's so many, as we know, it's so many different causes out there, so many different needs that people have these days, different causes out there, so many different needs that people have these days. So I know the most important thing, like they say, is not money. To me, it's time. It's giving up time, and that's an important thing to give up, is your time. People talk about money, but I always talk about your time, because if you got time, you could go out and make money. So to me, being able to do that, and then with the NFL alumni, because we have such a big platform, being former NFL players and playing in the NFL, you have such a big platform, you could reach out to a lot more people. You can impact a lot more communities by the work that you do in there. And that's why we're diving into communities like Pontiac, where I do a lot of work at, Detroit, where I do a lot of work at. I do stuff in Flint. I do stuff in Jackson, Michigan, because these are areas that need that. They need to see people like me. They need to know that they can achieve what I did, and they need to be able to touch, talk, and see me. So that's why it's important for me to be out there in the community and to be involved with the NFL alumni.
Well, I tell you, Lomas, if we've learned anything from this COVID pandemic, the key element is caring for each other. And I must commend the NFL alumni and you personally for an ethic of caring. So thank you, my brother, very much. Denise Rezo, from your perspective as the Chief Public Health Officer for the Detroit Department of Health, I must, first of all, just commend you and thank you and the 250 other professionals and all the other support teams that are doing the work to protect the public in Detroit. We have seen public health workers being vilified, harassed, cursed at, people attacking them in their homes and their front porches. This has been a very difficult time to be in public health. And so I hope that you will at least convey our appreciation and gratitude for all that you and your team does and has done and will do, continuing to fight for the optimal health for all of the people that live in Detroit. Well, from your perspective, you are aware that the U.S. is fast approaching 1 million deaths from COVID, but we know that national data is not nearly as important as local information. So can you give us a picture and a sense of where COVID is in Detroit? Is this pandemic over? Is it almost over? Will it ever be over?
So first, thank you for being here. It's really a pleasure to continue talking about something that has continued to plague the city of Detroit. I was appointed by the mayor in September of 2019, right, just before the pandemic. But I will tell you that I have never seen the city of Detroit perform so well when it comes to making sure Detroiters are protected and safe. This was never a one-woman show by any means. This was, it took an entire village. So working with our local health systems, working with our faith-based leaders, our schools, our community-based organizations. And I'll tell you that we are still in this fight for the last 2 years, and we are committed. So locally, when I look at COVID has not left the city of Detroit at all. It hasn't taken a vacation. It is still lurking throughout the city. But Detroiters are continuing to crave information. So our health department is continuing to provide education to let people know that COVID is still here. And we want to make sure that they are protected, they are safe. When the pandemic hit us in early March of 2020, we lost about 400 Detroiters in the first 30 days. So we were hit very hard. And in the last 2 years, to date, we have lost 3,412 Detroiters. Those are our friends, those are our families, those are our close neighbors. And that is not okay. So our Mayor Mike Duggan, has made sure that we provide equitable access to both testing and vaccination. So now you can go anywhere in the city of Detroit, you can get a test, you can get a vaccination without any problems at all. Our vaccination rates are still not where we need for them to be, but we are certainly headed in the right direction. And I do hope that one day we'll be able to say we are out of this pandemic for good, but we are certainly not out of the woods just yet.
You mentioned the vaccination rates, and in most parts of the country, we've done a pretty good job of getting people with the first series, whether it's the 2 shots of the Moderna or Pfizer or the 1 shot of the J&J. We did pretty well on that, but where we seem to have fallen off is on getting that next booster dose. That booster dose that we found through the science and the evidence is so critical to overcoming the Omicron variant when as that has devastated our country. How is Detroit doing on getting people vaccinated with their boosters?
Sure. So as I mentioned, for the first couple doses, we're right around 50%. So we have a long way to go before we get to 70%, which is what we call community immunity, particularly for the boosters. Of those Detroiters right now who are eligible for their booster, we're only at 21%. That's really low. And what we are trying to do with the support of Dr. Iris Taylor and Dr. Dunn and a few others on my team, we're trying to address vaccine hesitancy, which is real in our community. So again, we're at 21%. We have a long way to go, but the vaccine is available. And our job is to make sure, 1, that it's available, and 2, that we are educating Detroiters, of which we will continue to do.
Terrific. Well, good luck with that work. And we would just plead with everyone to really pay attention to your message. Lomas, the NFL Alumni's premise in all of the work it does here is to encourage individuals to talk with trusted healthcare providers, get the facts, learn about the science, and then make informed decisions. I know that you made the decision to be vaccinated. Can you talk about why you made that decision, and was it a difficult one for you to make?
No, it's actually a personal reason. My daughter, my oldest granddaughter, my daughter's husband and his father, they had COVID. And, I shared the story earlier that one night my daughter called me and she told me that she was getting ready to sit down and write her letter to the kids. She said it felt like somebody was sitting on her chest, and every time she would breathe, it would hurt. And, as a father, that just that hits you. No one wants to see their kid suffer like that. And it just really hit me when she called me and told me that. So I knew, and this was early when she got it. And really the good thing was that they didn't keep her at the hospital, because then they were putting people on respirators, and come to find out that was doing more harm in the beginning than it was doing good. So she kind of lucked out that way, that she was breathing on her own. But that showed me how serious it was. And that's why the reason why I chose to get vaccinated. And, and it's to protect people too. It's to protect loved ones. And also my wife has lost people on her side of the family from the virus too. So it's just kind of hit us hard. And really, it was really no reason for me not to get vaccinated. I couldn't see a good reason not to do it. You know, people find the reason. I just couldn't see a good reason not to go out and get vaccinated.
Thank you so much. Robert Dunn. Robert, let me ask you just to follow up on that point that Lomas makes about family members who have contracted COVID. We know about a syndrome called long COVID. Can you just remind us a little bit about what that's all about? What does this long COVID mean, and does it concern you?
Sure, it absolutely concerns us. And it's something that happens after other kinds of infections as well. But so many people were affected by COVID. That means there's so many more people who then have long-term symptoms. And these can lead to adult onset asthma, difficulty breathing. People have a mental fogginess that they describe. And that is something that is being studied. We have clinics that we can get people into to take a look at it and figure out the best way to treat it. But it's something we need to remember, that there are long-term effects on everyone in our community, whether it's the loss of a loved one, whether it's having a disease process that goes on for months or even potentially years at a time, or permanently changes your lungs. I have firefighters and police officers who have not been able to go back to work because of injury to their lungs from COVID, sometimes injury to their heart, sometimes severe blood clotting disorders. So we need to remember, as you mentioned, about taking care of ourselves as a community, that the decision we make about getting vaccinated and about doing good things for infection control really affect all of us.
Wow, very important. And Tina Chopra, let me turn to you on this point for a moment, because as we start to think about the vaccines and how they work, whether they're safe or not, I noticed that we've had 11.5 billion doses given around the world, 570 million in the US alone. What are we learning about the safety and the effectiveness of these vaccines? And if you will add to your comment, how important do you think it is for getting vaccinated as a way of trying to prevent these very frightening concerns about long COVID that we just heard about from Robert?
Very rightly, you have pointed out the millions of doses that we have had, all over the world. Not only thousands of doses in clinical trials have proven time and again that the vaccines are very safe and effective. FDA, as you know, sets very high standards for safety and efficacy. So, we have seen with all the data that is available that vaccines are very, very effective in preventing severe disease, hospitalization, and death as compared to unvaccinated individuals. So that is a given. Also, to your comment on long COVID, absolutely. We hear people all the time, it's going to be mild in children or it's going to be mild in adults with no comorbid illnesses. But even those adults who've had mild COVID and they were unvaccinated are ending up in our clinics with long COVID syndrome, which, like Dr. Dunn pointed out, presents in a very variable, diverse fashion. Some patients have a cardiorespiratory problem with shortness of breath, with inflammation in the heart. Then we have patients who have very severe fatigue. Young athletes, marathon runners are not able to run anymore after having contracted mild COVID. We have had patients come to us with severe confusion and loss of memory. We are going to be just like diabetes and hypertension in our community. We are going to see long COVID patients for generations to come. If all of this morbidity can be prevented with a simple measure like vaccination, I think it is a huge testament to science and proves the point time and again that it is so important to get vaccinated.
Denise, let me come back to you and just emphasize an important point about what vaccines are intended to do. And I think that what we've just sort of heard is that it sort of focuses on stopping some of the more severe consequences. How do you talk to your community about what we are expecting these vaccines to do?
Sure. So that's a great question. So one, it is so important to share with people the truth. We're never trying to sugarcoat anything. And what we've been saying with the support of our nurse educators, as well as our medical providers, is that if the vaccine keeps you safe, it keeps you protected, and it keeps you out of the hospital. We have said before that, when you look at where we were in 2020, as compared to 2021, we didn't have the vaccine. And now that we have the vaccine, it is going to save your life. And that is how we are communicating, again, very plain, very kind of a conversational dialogue so that people can understand. We typically don't get into the mechanics of the vaccine because we're not scientists. However, it is really important to be honest. And, we have, I believe, done a good job of not talking at people, but talking with them and really answering as many questions as possible. We, at the height of the pandemic, we set up a 24/7 call-in center where folks could call in and speak to a nurse educator about any question that they had, no matter how bizarre it may have been. We just wanted people to have the facts. And although we don't have that 24/7 line, we do have our medical physicians and our nurses available via social media, as well as during the day, so that Detroiters can call and get their questions answered.
By the way, would you please indicate now, and we'll put it in the chat as well, but what is the way that people can go online and connect with your department and your experts?
Sure. So you can visit our website at detroitmi.gov/health. Again, detroitmi.gov/health. There you can find information about the latest COVID-19 resources, as well as our dashboard. We have very transparent data on what's happening in our city. If you would like an appointment, you can call us directly Monday through Friday, 313-230-0505. Again, 313-230-0505. Or if you want to talk to a nurse, because we want to talk to you, you can call us at 313-876-4000. Again, 313-876-4000. And finally, we are very much in tune to social media. So you can reach us on Facebook, Twitter, and I believe we are on Instagram and Snapchat. So again, we want to hear from you. So send us a message today.
Robert, let me follow this line of questioning with a key issue for me. And that is that when you go onto the Detroit Health website, I think people should be looking for the information about the case transmission rate, giving some sense of how frequently this virus is currently circulating in the community. Do you see that as being something that the average citizen should be attentive to?
Absolutely. And it's something that we have really put front and center right from the beginning of the pandemic. Even as we were responding and setting up testing in the very early phase of the pandemic, we were also making sure that we were tracking data and making sure the public was aware of it. And it's not that everyone wants to look at those numbers, but we want those numbers there for people to see, because a big part of what we do is change our response, put additional resources based on what's going on in the community. So, everyone saw in December and January, we were having that big surge of Omicron. As we saw that starting to go up, we added additional places to get tested. We worked with the state and federal government to get test kits to get to people's homes. I mean, we gave out over 200,000 test kits during that period of time. And that was in response to those numbers. So we're watching them, and we want other people to watch them, because then they can help make good decisions about what they're doing, even things like travel and family get-togethers.
Or things like wearing your mask. And so one of the things that, again, before you go out in the morning, you check the weather report. If you are seeing that it's going to rain and it's going to pour, you put on your raincoat. It's important, I think, and see how you feel about it, but if you see on the website for your department's data, and you see that there is a significant prevalent presence of the virus spreading in the Detroit community, that ought to remind you that maybe today is one of those days, if I'm going out, I need to be wearing my mask. So I'd like you to comment on that kind of a scenario, but also we've seen some very important developments in the legal system in the last 2 days, where now in many of the places that were mandating masks, like on airplanes and public transportation, that will no longer, for the moment anyway, be required. How do we start to think about the way we use masks now?
Well, I think it's the same message we've put out about masks the whole time, is that masks help to protect you and help to protect others from you. And not only did we know a lot about masks prior to this pandemic from particularly other parts of the world where mask wearing was common during cold and flu season, but we've learned a ton about this during the pandemic. And I think that's one of the things that's a little frustrating about the ruling that you're talking about, because the CDC had actually been putting out some data and said they wanted to look at the next couple of weeks, and then that got struck down literally a couple days after they said that they were going to look at the data. And I think that's one of the ongoing challenges as we face health crises in the future, is that we want to make sure that there's really the authority in our health officials to do the right thing based on good evidence. And good evidence is that masks are a piece of that puzzle. A mask isn't a substitute for washing your hands. It's not a substitute for avoiding crowds, but is an additional layer of protection.
Perfect. And I'm going to be turning to Lomas in a minute for his question, but I'm going to throw one more at you right quick, Robert, and that is, I want to make a fine point on this vaccine conversation we had a moment ago. And that is this: you are a professor in the ER there. You're in the hospital in Detroit, in addition to working with the health department, Department of Health. Are you seeing in Detroit what we're seeing around the country, which is the overwhelming majority of people that are in hospitals are unvaccinated, and that the people who are vaccinated, while they may get this and have mild illness, are not moving to being so sick that they require hospitalization or are dying?
Absolutely. That is clearly what we're seeing. And when we look at our ICU patients and long-term admissions, we are seeing exactly what Dr. Chopra was saying, is that the vaccines are very powerful at preventing serious illness, hospitalization, and death.
Great. Well, thank you for that. Lomas, question is on your mind. And by the way, for the audience, we are again encouraging you. This show is for you. And so if you have a question, put it in the chat. Lomas.
Well, I guess my question for the experts here is that now sports venues have been allowing crowds back in there and allowing full capacity crowds without masks. Are you guys worried about future outbreaks coming from sports, sports gatherings, especially when the NFL gets back and college football gets back in there? You're talking 70, 80, 90, 100,000 people in one area again without masks.
That's a great question. Tina, you are an infection prevention specialist. What are your thoughts?
Absolutely. I think this is a great question, and everybody is worried about future surges with the mask mandates going down and people congregating in big gatherings. I think that is always a concern, especially in a community that has low vaccination rates. It is a big concern because it gives the virus an opportunity to mutate and form more variants. The future variants are definitely going to be more contagious. I mean, that's the only way a variant is going to compete with the previous variant and become more contagious. So this is a big worry. And that's the reason why we always say you want to gauge your own personal risk and your family's risk when you go out, when you do something, when you meet somebody. That you want to use all the tools in your toolbox, and masking is one tool. Social distancing is another tool, and the biggest tool of all is vaccination. And again, like Dr. Dunn mentioned, they don't work alone, they work together.
Wow, great. And Denise, from your perspective, as you engage with your mayor and try to give it guidance and advice about people coming together for massive sports events outdoors or the major concerts indoors, how are you thinking this through?
So just like Dr. Chopra mentioned, she's worried, and so am I, especially as a health professional. I speak to my epidemiology team nearly every day, and they are constantly looking at the numbers. Right now, about 100 people every day are getting COVID. However, as we continue to gather, as we continue to relax these mask recommendations, we are going to see the numbers increase. And that's something that we're just gonna have to deal with. But for me, it's really all about choice. We are giving Detroiters the choice, whether they want to wear their mask or not, but we want them to be extremely cautious because of our low vaccination rates. So if you know that the vaccination rates are low in the city at 50%, that means if you go to a grocery store, half the people in there probably are not vaccinated. And so for me personally, I always wear a mask when I'm around a lot of people. Even this morning, I was giving a presentation and there was 200 people in the room, and it was probably 2 people, including myself and another physician, who had their masks on, but I felt protected. So again, it's all about choice, and we want Detroiters to make the right choice.
Denise, Tina, as you think about this from your perspective, how do you sort of guide and advise people about this period that we're in now, where we're trying to make intelligent decisions about wearing masks, but now we have these variants that are spreading? And you mentioned a little bit a moment ago about a variant that variants that seem to be more contagious. How should we come to understand these variants? How do they occur? And are they always bad?
Great question. I think the most important thing as a physician, as an infection preventionist, as a public health official that we can do, and we've been doing all along, is acting as a bridge between the science and the community, acting as a community ambassador and helping demystify some of these facts and some of these myths that we have around vaccination. As far as your question around variants emerge. The virus is always mutating all the time. When the virus finds a host, like somebody who's not vaccinated, and a host who's immunocompromised, for example, and cannot get rid of the virus finds an opportunity to mutate at a rapid rate and emerge stronger, and then it can spread and become very, very contagious. Any virus that can exist, it will be more contagious because it is going to compete with the previous variant, just like with Omicron. Omicron is definitely much more contagious, the BA.1 variant. And now we have a second subvariant of Omicron, the BA.2 variant, which is 30 times more contagious. So every new variant is going to be more contagious because it has already competed with the previous variant. Does it cause more severe disease? Not necessarily. The variant is going to be more contagious, but not necessarily causing more severe disease. But regardless, the vaccines are going to be protective against severe disease and hospitalization and long COVID, which we all know has left many people non-functional.
Wow. So let me just try to go through that really quickly with you. So what I hear you saying, is that viruses normally do mutate. That's what they do. They change so that they can survive, so that they can continue to grow and live their lives. So they change based on circumstances. Sometimes and often those changes make it much more easy for the virus to spread. What we do not know, though, is every time it becomes more spreading, does it make you more ill? And that's one of the things we have to watch. This is a game of Russian roulette that we don't want you to play. We'd rather you just not get infected. And that's why we talk about wearing your masks and getting your booster shot. And so I think these are very important points. Let me quickly get to one of the things in the chat, and that is one of our listeners wants to know about, does the health department have the resources or outreach to get to the elder residents to do case investigations when sometimes there are budget problems for the department? Denise, what do you answer that?
So at the height of the pandemic, we put our seniors first because we realized that seniors, are the because again, seniors are the backbone of our community. We also know that seniors, when we look at all the congregate settings, a lot of the COVID cases were occurring right in our own communities, right in senior sites, in nursing homes, et cetera. So we sent our team of nurses out into the community. We ended up testing about 26 nursing homes in 10 days, which is about 2,100 nursing home residents. And we found that there was 25% of all of our nursing homes had COVID. And so we did something about it. This was 2 years ago. But even now, when there's a surge that may happen, we have surge teams, which includes a couple nurses and a data analyst, and they go out directly to that particular site, and they provide education, they provide outreach, they provide testing and also vaccinations and PPE if needed. So we are ready. We do realize that there are budget constraints. However, this is very important, and we will certainly meet that need.
I think one of the things also that I'm sure you would agree with me, Denise, and that is whether it's wearing our masks or being vaccinated, we have to be concerned about those who are vulnerable. And that's our seniors and our people that are immunocompromised. And so one of the things that we do hope is that as people make their decisions about what they are going to do for themselves, remember, in this pandemic, it ain't just about you. It's about you being connected to other people who are depending on you to do right if they're going to have a chance to survive this thing. And so I hope we do. Well, thank you for that answer. One of the things, Dr. Chopra, that we want to get to is this notion of children's vaccinations. And I'd like you to comment on your advice to parents about getting their children vaccinated. And as you do, respond to that. One of the questions that we have in place is that there is one of our listeners has a granddaughter who suffered from a complication after having had a flu vaccine. And so the question becomes, should her parents be concerned about her getting the COVID vaccine, given that she had this syndrome called GBS, Guillain-Barré syndrome, and should that be a reason for not getting the COVID vaccine? So 2 questions in one very quickly. If you would respond, we'd appreciate it.
Children should definitely get their COVID vaccines. We have vaccines available for 5 years and older, and they are approved and considered very safe and effective. Children do have poor outcomes if they are not vaccinated. We have seen very sick children hospitalized. Also, children can suffer from a disease called as multifocal inflammatory syndrome, which can leave them on a ventilator for a very long period of time and can also cause increased morbidity and mortality in children. So yes, vaccines for those children that age groups that are available should take their vaccine. As far as your question in the chat about GBS, I'm sorry to hear about the poor outcome in your granddaughter, but having this outcome from flu vaccine doesn't mean they will have the same outcome from COVID vaccine. They are different vaccines. So I would strongly consider getting her the COVID vaccine after discussion with their physician.
Outstanding. Thank you so much for those answers. Lomas, we have a chance for you to get in a question before we end.
Man, this is a lot of pressure. I emptied my clip on the first question, but but I keep hearing everybody talk about the long-term effects, and again, the long-term effects from the COVID versus some of the effects of people getting the vaccination. I mean, can you guys speak on that? I mean, wow. I think that's something that, because I know a lot of people, they think, well, I'm gonna have this, or I've had this vaccination. For instance, I've heard for females, younger females, that some were having problems with their menstrual cycle, that it messed some of them up. That's one of the reasons why one of my friends won't let his daughter, his younger daughter, get the vaccine. So it's just that versus, long-term effects for it. I guess that's what I'm asking. I
Robert,
guess that sounds like a question
It
is.
is
A question. Okay.
Oh, Robert, let me say, brother, that is one of the most important questions that you could have asked. And I'm going to ask Robert to deal with that. And that is the issue here, which you are pointing out. And Robert, I appreciate your insights. And that is, a lot of times people are so worried and are legitimately concerned about some side effect that they've heard about the vaccine, yet they fail to realize that the COVID infection causes that problem multiple times more than any problem with the vaccine. Can you help us to parse that out? Right.
Yeah, so I think that the really important piece of that is something that we do on our nurse line all the time, is to get the reliable information, to get exactly what you were talking about, to see what the actual description of what has happened. As we talked about before, there have been billions of doses of vaccine given. We track those. We have a reporting system. There are hundreds of thousands of people around the world that have been in clinical trials. So, and that information's all out there. It's all out there for the public. But I think the hard thing is to sort it out, to sort kind of the good information from the bad information. And get that actual, what does this mean? What is this? Because there are a ton of stories of a lot of different effects that really were not seen in any of the clinical trials. And there are some things that were seen in clinical trials. And that's where that balance is. That's much worse to have the disease to cause things like inflammation, like Dr. Chopra was talking about. And I want to make sure I leave a minute or two for Dr. Chopra to talk about this as well, because she has dealt with this repeatedly in some of her speaking engagements on this.
Well, with that, let's go to Dr. Chopra. And Dr. Chopra, if you will augment the point that you made earlier, for example, around multi-inflammatory system with disease with kids who get that from the infection itself, as opposed to getting that from a vaccine.
Yes, absolutely. And, to Loma's point about long COVID syndrome, the consequences are long-term, lasting, who knows how long, because there's still more research to be done. There's still so many things we don't know about long COVID syndrome, both in adults and both in children as well. So why would you risk getting long COVID and getting all these complications than just simply taking a vaccine, which is very, very safe, doesn't have any side effects. The reaction that you get from the vaccine is actually an immune reaction. It is not an adverse reaction. It's an immune reaction. It only tells you your immune system is working. Even the problems with menstrual cycle or problems with chills and fever and fatigue that may last for a couple of days is only an immune reaction, and it goes away. So vaccines are extremely safe and very, very effective. They keep you out of the hospital. They keep you functional and improve your quality of life.
And so if we, for example, one of the things that Lomas maybe also knows in his world is that some of the athletes have been concerned about this inflammation of the heart that has rarely, but has been reported, people getting that from after being vaccinated, especially some of these young athletes. They were concerned about it. But what people fail to realize, and this is to the point I think you're making, is that the incidence of that heart inflammation, if you get COVID, is multiple times more frequent. And so it doesn't make a lot of sense to worry about a very rare and almost unusual thing when the more real pressing problem is not getting infected from the disease that will cause those problems at a much greater level of magnitude. And so I think that's the theme for tonight as we start to close out here, is that what the NFL Alumni Association are encouraging people to do, since we can't cover every issue in the few minutes we had tonight, is to stimulate conversation and then encourage people to go to their health professional or to the Detroit health authorities and ask these kinds of questions to get more information. But if you're not boosted today, and you still have some of these concerns or questions, please ask more questions and get the information, because it is ultimately very important that we have the opportunity to save not only your life, but the people around you. Well, we're going to do a quick lightning round in the minute and a half or so that remains, and maybe 20 seconds from each of our panelists who can, starting with Denise, and then Robert, and then Tina. What is the one thing that you feel is most important to leave with our audience tonight?
Well, so I think it's so important that if you have questions, as you mentioned, then ask questions. Find someone that you trust, someone in your circle that has already been vaccinated. Listen to their story, and you'll be more likely to get your vaccine. We know vaccines save lives, and we want you to live. So please consider getting your vaccine and get boosted at the Detroit Health Department.
Terrific.
The one thing we didn't really touch on, because we kind of had a short time, but would be the key message that I would pass out is that if you're sick, if you feel sick, get tested, get checked out. One of the biggest game changers is we have many good therapeutic options for COVID. We've learned a lot about COVID. It's not just vaccines that got developed, it is treatments as well. So don't just sit and suffer. Get tested, talk to your health professional about some of the treatments that are out there.
Terrific. And then finally, Tina.
Who should get the second booster? Everyone 50 years of age and older should get the second booster. Also, if you are more than 12 years of age and you are immunocompromised, mild to moderate immunocompromised, you should get the booster. Thirdly, anybody who got the J&J as the first and the second shot should get the booster in the form of one of the mRNA vaccines. So those are the indications for boosters.
Very, very, very important point. Well, thank you all so very much for your expertise in sharing it with our audience tonight. Lomas, thank you, my brother, for your leadership in this fight. You are a critical voice in this, and you are reaching so many people through your work. We want to thank the NFL alumni and Janet Martrabroda, who is the executive in charge of the NFL alumni, for your commitment to communities all across this country. At the end of the day, this is all about keeping ourselves safe, but maybe even more important, it's keeping those who are our loved ones, those who are around us, those who are vulnerable, keeping them safe. We're all in this together. Ask questions and then get scientific answers from people who are trustworthy, who know what they're talking about. Please take the time, ask your questions, but ask them and get the answers from trustworthy sources. Have a great evening. Take care, everybody, and thanks for joining us.